You're okay? So tell me how all
How old
this...
are you?
I'm 34.
Oh, Lord.
I started... Have no fear. I started med school when I was 20, so I've only been at this 14 years. So...
Okay.
Um,
Okay.
so-
I mean, I'm not biased, so I'm just looking
It's
and I'm going,
There's
okay.
a big difference from him to her. You know, because he's what?
Yeah, because Dr. Hopkins, I chose him because he was so much older.
Mm-hmm.
And he was, was old school, so I
Uh-huh.
chose him for that reason. Not that I have a problem with you.
No.
You became highly recommended. I can't say how.
Sure.
But when I was in the hospital, I told him, because he was giving me someone else's, I said, I heard about Hightower.
Yeah.
And so he goes, oh yeah, I know her. And I was like, okay, well make sure that you put me with her.
Right.
So it was a personal choice because
Yeah.
of the reference that I got about you.
Absolutely.
But no one told me that you were a young lady.
Well, it's okay. I have been at it for a long time.
Okay.
So, and actually, yes, when you think about medically, sometimes we go for experience, but when you think about like chemo and the new like choices, our choices change about every 5 years.
Yeah.
So you'd probably rather have somebody that's a little bit on the young side to give you some of the more up-to-date treatments.
Yeah, because he did not give me any breakthrough medicine. And
Yeah.
that's what I was telling the nurse.
Uh-huh.
And my pain level is still, for me, it's still too high.
Mm-hmm.
And I have some family members that are nurses and that are, like you, they've been nurses for 15, 20, going through here.
Mm-hmm.
Something's wrong with that. And the only time it kind of loosens up is if I do take some type of, pain medicine for it.
Mm-hmm.
But I've been explaining to him that I shouldn't. He's like, oh, you just got to keep moving your arm. And I'm going, I'm actually doing way more than what I should be doing. You know what I'm saying? I'm not at home going, oh, guys, reach this because I can't do it. I'm literally cooking, cleaning, washing dishes, not every day, but enough to where that.
Which is just when the arm lymph nodes are gone, your arm can swell a little bit. And it doesn't happen to everybody, but the more lymph nodes you have removed, the higher the chance that could happen. But we have a lymphedema therapist that can take you through exercises, and she can give you a lymphedema sleeve, to wear at night, and a lot of times that keeps the swelling from happening, and it's a good thing to learn the exercises and get the sleeve, because that can kind of ward off any of the...
Well, that's already been happening. I talked to Dr. Hopkins about it yesterday, and he was like, okay, well, that's common. And I'm like, but it's been long enough where I shouldn't still be swollen like this back here. And so again, he's really old school, and I think for him a lot of things are just going to kind of
work themselves
right, but
So when she said 15, that's 15?
Huh?
She said 15.
15 lymph nodes.
Oh, okay.
So he removed 15, because usually if one of them's positive, we'll remove all of them to see how many are involved.
So they took 15 altogether.
They took 15 altogether, but only one of them had cancer cells.
Gotcha.
Okay.
So, but...
So that's why you're hurting.
So that's probably why we're hurting.
Right.
So I think we ought to kind of increase our pain management a little bit and get you to our